We have about 2,000 active patients that we take care of here at the clinic. Most of those folks have a chronic disease such as diabetes and hypertension, although we are able to manage some acute care issues that come into our office.
My name's Cheryl Winkins. I called up here. In fact, Doug was the one that answered the phone, and I told him I didn't have no health insurance, and found out that they could help me. And with the clinic's helps, I saw the heart doctor, Dr. Nandra, and he examined me and everything, and a week and a half ago I had surgery.
We found out that her right coronary artery was totally blocked and the left one was 70 to 80%. Even though she had no health insurance, we were able to talk to the surgeon, the hospital, to make sure they could provide state-of-the-art care for her. If she had not come to our office and she received no further treatment, I think she probably would have had a massive stroke eventually and not survived. She's a lucky woman.
They called the different doctors to get me in to see them. And I mean, I'm just blessed. I'm very blessed.
I lived in Columbus, Ohio, and I was very sick. The doctor told me that I had been diabetic for years and I didn't know it. So when I became very ill, she told me that it was like past the point of no return. The doctor said that I only had 6 months to live. So I had told Miss Juliet, the medical assistant, that I was very sick with my diabetes. So she was very compassionate. And she told the nurse practitioners about my plight. I've been here a year. I'm so much better. I'm very happy here. And they gave me hope. I had given up, but they gave me hope. They made me strong.
You go into the exam room and you can see the look of angst on their face, but when they leave, they just tell everybody, thank you for being so nice, thank you for trying to help me. That's what you hear the most, I think.
God bless me to come to the Forest View Health Center.
When a patient comes to see a doctor or nurse practitioner, that's the key thing. You have to have a doctor or nurse practitioner. That's why it's so important for more folks to volunteer and come and be a part of our team here.
I know that even if I'm rather tired toward the evening when I'm done with my office, when I come to this facility, I certainly perk up. I think there's a purpose in coming to this facility, and I encourage other physicians to participate, and they would certainly find it gratifying as well.
We had 14 doctors and nurse practitioners volunteer their time, and a multitude of other volunteers and students, providing over 3,800 hours of volunteer time. They are genuine and concerned and loving towards our patients. They are such fine examples of what doctors and nurse practitioners should be. I see so much for the health center in the future. This is our time to grow. We need to be in our own building. We need to have our medical care and our dental care and the mental health care and our medication room all under one roof. And this is the time. This next year will bring big changes for us and will allow us to keep the care going for our patients and to expand those services, which means so much to so many people.
Despite the implementation of Affordable Care Act, expansion of Medicaid and Medicare, I think this clinic still needs to survive at its full capacity.
We provide so much more than medical care and medication. We provide encouragement. We provide education on the chronic diseases. We connect people to other services. But I think the most important thing we provide is hope. We give people hope that they can have a happy and a healthy and productive life. And we're so proud that we can be a part of that.